DUR ITS. Hello, this is Young-Rae Jo, Deputy Director in charge of DUR and ITS in Health Insurance Review and Assessment Service. Korea is in great pain after an unprecedented outbreak of COVID-19 in January 2020. And the disease spreads across the country now. There are the two systems playing a critical role in detecting those infected with COVID-19 early and preventing the spread of the disease. They are the International Traveler Information System, ITS, and Drug Utilization Review, DUR of Health Insurance Review and Assurance Service, HIRA. From now on, I will explain you about the background of establishment of ITS and DUR and how they are used in the fight against COVID-19. This course will be provided in the following order. First, I will explain you about the learning objectives of today's lecture, followed by legal grounds of information provision through DUR and ITS regarding infectious disease, difference between DUR and ITS, targets of information provision and types of information provided, information provision process via DUR and ITS, how healthcare institutions can access to the systems, and the number of healthcare institutions using the information provided by DUR and ITS, and future tasks. Through the course, you will learn about the following items, including an overview of DUR and ITS, providing the information on entrants from countries where infectious diseases occur and those having contacts with infectious individuals, types of infectious diseases that the two systems are designed to provide the information, how the systems work from the collection of data on foreign entrants to provision of such information to healthcare institutions, and how healthcare institutions check the information by stage, including reception, diagnosis, prescription of drugs. I will briefly explain you about the background and progress of DUR and ITS. Korea began to stress the importance of infectious disease management since 2015 as the nation faced with a crisis in the public healthcare system with the spread of Middle East Respiratory Syndrome, MERS. The disease caused the nation to experience an economic recession and made people feel uneasy. In the midst of growing uncertainty, the Drug Utilization Review, DUR of Health Insurance Review and Assurance Service, HIRA, took the lead in the fight against MERS. DUR was designed to provide the safety-related information on drugs, including ban on combination of drugs to healthcare institutions in real time to prevent inappropriate use or side effects in advance. It allowed communications with doctors and pharmacists while prescribing and dispensing drugs, and data collection on a real-time basis. By using such features, the system was able to provide the information on travelers entering Korea from countries contaminated with infectious disease in real time, contributing to preventing the disease significantly. Later, Korea Center for Disease Control, KCDC, and HIRA has jointly developed a separate system called International Traveler Information System, ITS, to provide the related information while receiving and treating patients in order to prevent the spread of infectious disease in healthcare institutions in the earlier stage. They have distributed the system to hospitals across the country in preparation for the prevention and control of infectious disease. Let's move on to the overview of DUR and ITS. HIRA provides the information on entrants from countries where infectious diseases occur and those having contacts with infectious individuals through DUR and ITS. First, DUR is developed to provide the safety-related information on drugs, such as ban on combination of drugs to healthcare institutions when doctors and pharmacists prescribe and dispense drugs, in order to prevent their inappropriate use and side effects in advance. This system provides the real-time communication and data collection features, and HIRA was able to provide additional information on entrants from countries where infectious diseases occurred, and those having contacts with infectious individuals to healthcare institutions upon the outbreak of MERS in 2015. However, such feature has some limitations as the information is provided to the institutions upon the prescription stage when a significant amount of time passes that is sufficient for concerning patients or those contacted with MERS patients to move around the hospital, and which highlighted a potential risk of infection of those having contacts with them as well as medical personnel. Thus, KCDC and HIRA developed a separate information search system, ITS, to provide such information in reception and medical treatment stages before prescribing drugs, and the system began operation in January 2018. Legal grounds allowing DUR and ITS to provide the information with regard to infectious diseases are as follows. Article 76-2. Request for provision of information and verification of information of the Infectious Disease Control and Prevention Act stipulates that the Minister of Health and Welfare or the Director of the Korea Centers for Disease Control and Prevention may provide the collected information on concerning patients of infectious diseases and persons suspected of contracting infectious diseases such as personal information and records of immigration control, etc., to the President of the Health Insurance Review and Assessment Service, health and medical services institutions, etc., to prevent infectious diseases and block the spread of infection. Also, Article 47-2, targets of information provision to block the spread of infectious diseases of the Enforcement Decree of the same Act, specifies that the Director of the Korea Centers for Disease Control and Prevention may use the Information System of Health Insurance Review and Assessment Service to provide the information collected to prevent infectious diseases and block the spread of infection to medical institutions and others. Let's find out whose information is provided to healthcare institutions and which information is provided. With regard to infectious disease-related information, we have provided information on entrants from countries where 6 types of infectious diseases occur, and persons having contacts with confirmed cases to healthcare institutions. Here, the 6 infectious diseases include MERS in 2015, Zika virus, Ebola, Lassa fever, plague, and COVID-19 in 2020. When entrants from countries affected by the infectious diseases listed above and persons having contacts with infectious individuals visit healthcare hospitals, a pop-up message appears on the screen as you see in the right of the screen. Doctors and pharmacists are advised to isolate patients with suspicious symptoms of infectious diseases and report to KCDC or the local health center immediately. Likewise, the system plays a critical role to minimize the damage, including prevention of medical institutions and their workers. Let's take a look at the message in the right of the screen, which indicates the result of infectious disease search. For your reference, this patient entered Korea after visiting foreign countries. Please call 1339 or report to the local health center if you detect any COVID-19 symptoms, such as fever or respiratory problems, cough, difficulty in breathing, etc. Cautions for medical institutions. 1. Do not transfer the patient who is subject to be reported to other hospital or send the patient to his or her home, and isolate the patient in a separate place. 2. The patient who is subject to be reported, medical personnel and hospital employees should all wear a face mask. Make sure not to disclose any personal information, and beware of the rejection to undergo medical treatment. Go on to the information provision process regarding infectious diseases. The Ministry of Justice, Ministry of Foreign Affairs, airlines, shipping companies, and mobile carriers send the information on their passengers and subscribers entering Korea, and KCDC collects their personal information. The information collected by KCC is automatically sent to HIRA for 4 times a day via the administrative network, and HIRA sends back the information to healthcare institutions immediately through its DUR and ITS on a real-time basis. When patients visit healthcare institutions, doctors and pharmacists check the patient information in real time via DUR and ITS while prescribing and dispensing drugs. Healthcare institutions are required to report abnormal symptoms of patients suspected of infectious diseases to the local health center or KCDC and isolate them in a separate place. The history of inquiry on entrants from countries affected by infectious diseases or those having contacts with infectious individuals by healthcare institutions are sent to HIRA in real time, and HIRA sends such data received by the healthcare institutions to KCDC once a day, to KCDC via the administrative network for epidemiological investigation. Next, I will briefly explain you about how healthcare institutions check the information regarding infectious diseases. When a patient visits the healthcare institution, he or she should make an appointment to see the doctor, and a nurse or administrative staff can check the information on the patient regarding infectious diseases, such as entrants from countries affected by infectious diseases, or persons having contacts with confirmed cases from the check-in screen of the EMR, Electronic Medical Record System, for scheduling connected to ITS. When the patient visits the doctor for medical treatment, the doctor checks the information mentioned above on the medical treatment screen of EMR system linked with ITS. Third, when the prescription of drugs is made for the patient after diagnosis, the same information is checked in this stage again via the prescription screen of the EMR system linked with DUR. Pharmacists, too, can check the information via drug dispensing screen of the information screen of the pharmacy connected with DUR. For your reference, ITS provides a separate search screen other than ones linked with EMR system, so that healthcare institutions without their own computerized system can access such information. Next, the status of medical institutions using the information related to infectious diseases. As of June 19, 2020, 72,366 healthcare institutions, or 99.4% of the total, are accessing the information of HIRA related to infectious diseases. The usage rate of ITS and DUR by healthcare institutions was a mere 54.1% on January 25, 2020, before the spread of COVID-19. However, the rate increased to 99.4% as of June 2020, as the government, HIRA, and medical associations proactively promoted DUR and ITS to prevent the further inflow of COVID-19 into Korea and block the spread of the disease. We have recognized that providing the information on entrants from countries affected by infectious diseases and checking the information by healthcare institutions via DUR and ITS are critical to prevent the inflow of a novel infectious disease and block the transmission of the disease as an effective approach owing to the outbreak of COVID-19 in January 2020. Currently, healthcare institutions are required to check the history of international travel in accordance with the Infectious Disease Control and Prevention Act. But there are no restrictions on the violation of duty, such as penalty, etc. Healthcare institutions have already provided with various information and are tired of checking the information. Hence, it is likely that healthcare institutions may not search the history of international travel during normal days when an infectious disease is not a cause of grave concern. To help medical institutions use DUR and ITS during ordinary days when there is no outbreak of an infectious disease, we need to constantly monitor the status of use by hospital to improve their usage rate, conduct site visits to the ones that are not using DUR and ITS, and strengthen our effort to promote the two systems. Thanks for listening.